So from a replacement point of view, we do total hips also instead of a hemiarthroplasty, and there are certain clear guidelines from NICE which we follow in terms of which patients would benefit with a hip replacement. So if you're independent, if you're driving a car, if you don't have significant amount of medical comorbidities or medical conditions, in my practice I would offer them a hip replacement. Mr. Jacob, would you do the same thing?
Absolutely, yes. It's pretty much getting popular now that hip replacements are a good viable option for those who are medically fit and enjoy a good high standard quality of life and don't use any walking aids, and the age is not becoming a bar to having a hip replacement.
It primarily depends on what your lifestyle was before and what your mobility was before. Now moving towards the next stage, that is the fixation. We do certain kinds of fixations. We can put a nail into the femur, or we can put a plate on the other side. Now, Mr. Jacob, this is for you, and I'm going to have this one. Okay.
So this is a plate that attaches to the outside of the bone, and that's anchored to the bone with multiple screws, and that goes into the bone there, like so there, and that is anchored to the broken bit of bone, thereby stabilizing the ball onto the rest of the skeleton and allowed to walk.
And this is where a nail goes inside and holds the fracture. Various fractures can be treated differently based on a plate or a nail. The incisions are slightly different. If you're using a nail, you'll have a smaller incision, but the research is not entirely clear which one benefits which one. In our practice, it is based on the what kind of fracture pattern is, but from the rehabilitation point of view, it should not make a big difference whether you're using a plate or a nail.
Absolutely, yes. The jury is out on whether you use a long nail, short nail, whether you bolt the nail at the end of the knee or you leave it unbolted with a shorter nail. But pretty much the idea being, as with all fracture fixations, the idea is we want to get the patient walking straight away. And these fixations enable the patient to walk as best as possible. We don't expect them to be lying down or just lumbering around slowly. If grandmother had been walking to the corner shop, we'd like her to walk back to the corner shop, but preferably as best as possible without a walking aid, but more often than not, they end up using a stick or a cane to do so.
So it is quite vital when you have these kind of fractures to offer the surgery at the earliest possible availability with the right surgical skills set available from a surgical point of view, and then to rehabilitate them as soon as possible and get them out of the hospital and into their surrounding environment as soon as possible, because from an elderly patient's point of view, they lose a little bit of confidence when they have this fall. It's quite vital to get back their mobility and their confidence and their independence. Otherwise it is difficult to get back to their own homes.
So physiotherapy is key. We employ physiotherapists, occupational therapists who come home, visit the elderly population and see whether there's any modification that's made so that they can get back to rehabilitating themselves as soon as possible. When would you allow them, say for instance, you've done a hemiarthroplasty, half a hip replacement, when do you allow them to, say for instance, drive a car?
A good question.
If they have been driving a car already.
If they have been driving a car already, a good question. It depends on what their mobility is. So the ballpark figure in all orthopedics is 6 weeks. But it depends on whether they are able to do an emergency stop. That's what I always tell my patients, that if you think that your family member is in front of you and if you have a car and if you can do an emergency stop, then you should be able to drive. But the ballpark figure is about 6 weeks.
That's right, okay. And what about if they are engaged in sports like, bowls, lawn bowling, or something similar, golfing?
As soon as they're comfortable, but the priority here is that to make sure that they don't have repeated falls. So if the patient sustain this fracture by a fall, we always encourage the patient to go to a falls clinic so we can prevent these kind of fractures. So that is fundamental to get the confidence for them to go back to what they want to do. bottom line is these fractures should not prevent them from going back to their normal lifestyle if appropriately treated during in the hospital and also when they go home.
Yes, absolutely. So the key is prevent the second injury from happening and remove all obstacles, make the environment safe so that they don't have the second injury. Thank you very much for watching this video. We do trust that it's been helpful for you.
And remember, your health is your responsibility. Thank you for watching us.